watching Fox 8 News.
6:40 now. Swimming can be a great way to escape the heat, but plenty of dangers come with it, especially for young children. Supervision is essential around a pool. With more on swimming safety is Adrienne Cortez with Terrebonne General Medical Center. Thank you so much for joining us this morning.
Thanks for having me.
Give us just some of the basics of ways to keep your kids safe around a pool.
Some of the basics. First of all, supervision, of course, is essential. Children should never swim alone. Always have adult supervision. Don't leave them even for a second. They're very quick. If you have a large party, maybe a gathering, then it's a good idea to have an adult maybe watching over all the children in the pool, as long as the children are age 4 and over. If you have children younger than that, then of course you should have one-on-one supervision.
Okay, so younger than 4, you should, if you have 2 kids, 3 kids younger than 4 in the pool, you should have 2 or 3 adults in the pool.
Absolutely,
okay.
And they should always be at an arm's length away from infants or toddlers, whether those kids are in the pool or out of the pool. Always be at arm's length. You know, never assume that someone else is watching your children. Always know where they are. And if your child is missing, most importantly, always check the pool first. Those seconds are critical when you're looking for your child.
And is there you said about 4 and under, is there an age where maybe supervision isn't as necessary, or you don't have to have all the flotation devices on? Is it an age, or is it just based on the child's skill in the water?
Well, no matter what their skill, I think ages, infant to age 12, they should always be adult supervision, no matter what their skill. Of course, a good idea is enroll your children in swimming lessons, ages 1 and over.
So at the age of 1, they can take swimming lessons? Really?
Some do. Now, I have seen where they are teaching lessons even younger than that. A child 6 months and under, never put those children under the water. They do naturally hold their breath under the water, but they do swallow. And so enough swallowing, they can eventually inhale the water. So you wouldn't want them to do that.
And if you own a pool, or even if you think you're going to be around the water, parents, you would recommend taking CPR courses?
Absolutely. Absolutely. It's critical. I can show you a few steps here, but it won't substitute being certified in CPR. And the more hands-on that you get, of course, the more comfortable that you'll become doing this in an emergency situation.
And you were saying it's going to be a little different between an infant and a child a little bit older.
An infant we consider ages 0 months to 11 months.
Okay.
Okay. A child we have 1 year to 12 years old. Okay.
Oh, so 1 to 12, the rules are basically the same.
Slightly different.
Okay.
Just slightly different, yes. Slightly different technique. And if you'll take the child, I'll walk you through it.
Okay. I'll take the child.
It's not rocket science.
We're going to
do fine. We can do this in 4 basic steps. I want to keep this simple for everyone in the event of emergency. First step is determine responsiveness.
Okay.
So the way we're going to do that is shake the child's shoulder gently.
Okay.
Baby, are you okay? With infants, you can tap the feet. They usually respond to that. If your baby does not respond, if your child does not respond, you're going to immediately begin step 2, which is CPR, and you're going to do compressions. On the infant, you're going to use 2 or 3 fingers. I generally use 3. And on the child, you'd be the same. You're going to use the heel of your hand.
Okay.
And we're at a disadvantage here because of our height, and you'll clasp one hand over the other hand. For the baby, like I said, 2 or 3 fingers. You're going to, in between the nipple line, just below, in the middle of the chest, we're going to start compressions, quick compressions, about 100 per second. Ready?
And about how many?
And we're going to do 30.
What strength? I mean,
on the baby, you're going to go about 1.5 inches deep, and on the child, about 2 inches deep.
Okay.
Okay? And so we're going to start, and we're going to do 30.
And so you do 30
quick compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, all the way through 30.
Wow.
Okay? We go to 30. Step 3 is going to be open our child's airway. In order to do that, we're going to lift the chin slightly and tilt the head back.
Okay.
Not too far, because that'll actually occlude the airway, just in a neutral position. Step 4 is going to be actually give breath.
Okay.
Now, on the infant, 0 to 11 months, we're going to go ahead and cover the whole nose and mouth with our mouths.
Because, yeah, I mean, it'd be small enough that you could do it right.
On the child, it's a little bit different. You're going to pinch the nose.
You pinch the nose and then
open the mouth, and we'll give 2 quick breaths.
1, 2.
You know, of course, we won't actually do that here. And then we'll go back to do compressions.
So, okay, so those would be the steps to check response.
Those are the steps. Check response, start compressions, open the airway, and give 2 breaths. We'll do this for 2 minutes.
Okay.
Okay, that's usually about 5 cycles, 30 to 2. and then call 911. And that's the difference between child and adult. We don't initiate, if you're by yourself, don't initiate, we'll call 911 after we initiate 5 full cycles of CPR.
And just the tips you gave us are very helpful, but these 4 tips, to viewers isn't enough.
No, it's certainly a refresher.
They need to go through the CPR training.
Absolutely. It's certainly a refresher to those who have already been certified in CPR. But if you haven't, like I said, get certified. EMS gives classes, hospital gives classes, Terrebonne General, we offer classes year-round to our community. It's easy to get certified, and I would definitely suggest that.
Well, thank you very much, Adrienne Cortez, for joining us this morning. All very helpful tips, especially as the summer months continue and people start swimming a little bit more.
Thank you.
All right, thank you for coming in. All right, well, trouble for the Voodoo. Why, after just 14 games, the head coach is fired, and NBA team owners could impose a lockout just like the NFL did this week. We'll explain.